You can sit right there. No. You go stand, okay. Laying that up a little bit.
I get no way to just call me.
All right, good afternoon, everyone. Okay, I think y'all can do better than that. It's a beautiful opportunity today. So, good afternoon, everyone. Okay, much better. I'm Kim Boswell, the Commissioner of the Alabama Department of Mental Health, and we're here today to celebrate a significant milestone in the transformation of mental health services in Alabama. Today, we're here to celebrate the opening of the AltaPointe Behavioral Health Crisis Center. And honestly, it is no small task for AltaPointe to have been able to stand up this crisis center in 8 months and in the middle of COVID. So I want to take this opportunity to thank Turk and the AltaPointe team and all of the staff. Let's give them a round of applause. I also want to take the opportunity to thank the Department of Mental Health staff who supported the crisis initiative over the last 2 years. If you're DMH staff, and also John Levitt, who is our project director, if y'all will please stand. We are very grateful that John is standing today. He had a very serious car accident a few months ago, and this is actually the first time we've seen him stand. He was actually in a wheelchair for a while. So, and really, in addition to the crisis center, of course, AltaPointe wanted to be ahead of the crowd, so at the same time they were trying to stand up the crisis center, they also applied for a national grant, a very competitive grant with our federal partner, SAMHSA, called CCBHC. And they were awarded that grant a few weeks ago, $2 million. And more services to Mobile and expansion of integrated care for people with mental health issues. I am so proud of you, Turk, and I am so proud of your staff for really leading the way and really having high expectations and providing state-of-the-art mental health care in Alabama. So thank you. 24/7 availability of crisis services is critical to individuals so that they can have the right care at the right time in the right place. This is a great opportunity for law enforcement to be able to drop off individuals who are in a mental health crisis. It's also a great opportunity for families and individuals to be able to come here and walk in and get the mental health care that they need. So that is a huge, huge accomplishment. It is also a time to celebrate, particularly for our first responders. Do we have some first responders in the room? Wonderful. Today you have a new choice. Today you have the opportunity to bring someone to the crisis center. No longer do you have to determine whether or not you're going to take someone to jail or take them to the emergency department where they may be boarded for many, many hours. So we celebrate today that we support our first responders in their ability to bring folks here and be able to get the right care that they need. Over the next 5 years, we're going to transform mental health services in Alabama so that all Alabamians can have access to care. Amen. We also want to celebrate today the support of the legislature and Governor Ivey. In January of 2020, in her State of the State address, Governor Ivey made it clear that improving mental health services in Alabama is a #1 priority in her administration. She followed in the footsteps of her mentor, Governor Lurleen Wallace, and provided substantial funding for mental health services that we have not seen in many, many years. She also rallied the support of members of the legislature, and as we went into the legislative session, there was a full package of mental health legislation that passed with bipartisan support. While that was being discussed on the floor, many members of the legislature stood up and talked about their own personal experiences with family members, with co-workers, with friends who could not get the help they needed when they were in a mental health crisis. And through that, they made their commitment to support mental health care in Alabama. As we approach the legislative session this year, those of us in mental health really sort of cringed because we weren't sure what the economic situation was going to be. We weren't sure what the general fund budget was going to look like. Many of us had lived through a $40 million cut to our budget. And so we were really very concerned that this past year would not be a good year for mental health. Thankfully, through the leadership of Governor Ivey and the legislature, there was an appropriation for an additional crisis center in Region 2, which is the Birmingham-Tuscaloosa area. So even in the midst of real challenges, we saw support. Thank you, Governor Ivey, and thank you to the members of the legislature for all you've done for the Department of Mental Health. It is a great privilege to serve as a member of the cabinet for Governor Ivey, and I am so happy to have been appointed in December of last year. I've been around state government for 27 years, a little longer, actually, Chuck, I've lost count of the years. I actually think it's longer than that. And I've seen state government flourish, and I've seen state government flounder. And what I know is it flourishes when we have strong leadership. And Governor Ivey is the kind of leader who is deeply committed to transparency. She is also not afraid to make the hard decisions, and I would say this past year has been a pretty challenging year. But most of all, the thing that I admire about Governor Ivey is her commitment to the people of Alabama and her great love for the citizens of Alabama. Everything that she does, every decision she makes is about the people of Alabama. Ladies and gentlemen, the governor of our great state, Governor Kay Ivey.
Good afternoon, everyone. Thank you, Commissioner Boswell, for the fine introduction. You're very gracious. Today is a special day, and it's certainly an honor to be with you as we cut the ribbon to new accomplishments for mental health. In my State of the State, as Kim said, I called on the state legislature to provide funding for 3 new mental health crisis centers in our state. And I am so pleased to be here today to celebrate the fruition of such hard work. In 1861, Alabama became a national leader for mental health. Dorothea Dix opened Rice Hospital in Tuscaloosa because she was alarmed over the treatment of mental health issues or lack thereof in jails. But folks, we are here today for the same reason. AltaPointe's mission is to provide help to people because our EMT and law enforcement and jails just are not trained to support and handle some of these things. There are so many people out there who are dealing with trauma and who are hurting. These folks have some kind of chemical imbalance or born with a special need that requires medication or therapy. And it's our job to provide them access with the trained professionals who can truly address their issue. Unfortunately, what we've seen in past years is that emergency rooms and jails are warehousing individuals with mental health rather than getting them the help. We need to address the problem rather than just treat the symptoms. The pandemic has only escalated these issues. A statistic that our national overdose death hit a record in the last year with 93,000 individuals committed suicide. That's a nearly 30% increase in just 1 year. We certainly have to start intervening early and often before people's rights are taken away, before the worst happens to a family. AltaPointe is providing the necessary supports in place to help individuals get the proper care they need, and is an example of what I expect to see replicated in all regions of the state. Huntsville and Montgomery each have a crisis center location, and the Birmingham-Tuscaloosa region will be announced this fall. As a state, we will continue to make mental health a high priority. And as we work to expand mental health care, and if these centers are as successful as we think they are, we should expand these services all across our state. It's imperative to be able to provide a place of care for those in need. And I'm committed to doing everything possible to do that. Thank you all so much for having me here today. I'm pleased to be with you, and may God continue to bless each of you and the great state of Alabama.
Hello and welcome. I'll move this up here. I'm Turk Schlesinger. I'm the CEO here at AltaPointe, and I should say / Accordia Health. But I have to say, in 1998, I came over here to Mobile to take this position. One of the first things that I heard was, your predecessor had a governor who came down here and did a groundbreaking and a ribbon cutting. And I thought, that's never going to happen for me. So I'm proud to say this is actually our second time to do this. Governor Ivey came to, of course, most of you know that AltaPointe has been really starting to participate a lot more in whole person care. So AltaPointe is a CCBHC, as Commissioner Boswell just said. We just got that grant. But we're also a community mental health center and an FQHC, a federally qualified health center. And we were able to open up a federally qualified health center in Coosa County, which is probably the most rural county in Alabama, the only county that is so rural that it doesn't support its own health department. And so we were able to do that. And I think as we continue to move forward, we're going to continue to look at whole person care across the board. But thank you, Governor Ivey, for being here. Thank you, Commissioner Boswell, the legislature. This is a monumental moment. And what we're seeing right now, as the commissioner said, I don't remember in my 30 years in behavioral health, I don't remember an administration that has been this committed to making us better. And I just want to thank you for that. I think the future looks pretty bright for us here in Alabama. You know, like you said, we have 2 other crisis centers that have been allocated, one in Huntsville and one in Montgomery. And so Jeremy Blair is the CEO of the Huntsville Mental Health Center. He's a very bright young leader coming into our state, very passionate about what we do. I think Donna Leslie, who is the CEO of the Montgomery Mental Health, they have their new crisis center, and I know they had their grand opening last week. They're 2 bright people coming into the behavioral health community. So our center, our crisis center, is here to take care of 7 counties: Mobile, Baldwin, Washington, Clark, Conecuh, Escambia, and Monroe. So we have the 7 counties that we're responsible for. So this crisis center is here to serve all 7 of those counties. And when we were looking at this, we were thinking, what is a realistic space for someone to travel in order to be able to reach crisis care services. And so many of you, a lot of you are here representing some of those areas, but I do want to say thank you for some of the attendees that are here. First, I want to thank Mayor Simpson for coming today. I really appreciate you being here, Mayor, and I know he has been a huge supporter of AltaPointe. Representative Bracey is here. Representative Bracey, where are you? There you are. Thank you for being here. Joe Bonner is here, and Joe has been a great friend for years and years of mine and of mental health. Thank you, Joe, for all you do in Montgomery for us. Mobile County Sam Cochran, who has been working with me probably since I came in here. Sam, I think, talking about the very issues of policing and trying to police people who have mental health problems and what can we do. We had multiple meetings, but we were never able to really move the bar like we needed to without this kind of crisis center funding. And Sam's, of course, also over the Mobile Metro Jail. And that population in there is in strong need, and we have strong relationships that we work with them there. And Commander Graves from the Mobile Police Department is here, and I know he is glad to see this service being added too. So those are the ones who've been represented coming from the 7 counties. Also, can my board of directors please stand? I have many board members who are here. So as you know, they're the ones responsible for all this. They challenged me some 23 years ago. They said, as you come in here, Turk, this is a big city, this is a big area here in Mobile, and we challenge you to make sure that your staff fill the gaps that we have in mental health care in our area. And so for 23 years, our team, leadership team, can leadership team also stand up and wave, please? We have 16. We have 16 leaders in this organization that, if I get out of their way, they do great things. And I appreciate everything that they do because, of course, they're the ones that are making it happen. One of the challenges that we had was to fill in the gaps. And some of you who've been affiliated with us for years know which gaps that we had. Those gaps were in the hospital business, 277 beds throughout the 90s of acute care psychiatric hospitals closed down in our area. And so when those 277 beds closed down, some of those were children's psychiatric services. The Mobile County Commission got with us, me and Julie Belcase, my right-hand person, probably 20 years ago and said, we've got to do something. We have children who are coming that are from Mobile and the surrounding areas, and they're going to Dothan to be in the psychiatric hospital, or they're going to Birmingham. Is there anything that you can do to help us with our children's psychiatric needs? And so in 2004, we opened up Bay Point Hospital, which is a 100-bed hospital for children and adolescents. In 2006, we started seeing that the growth was tremendous. And so Dr. Sandra Parker, our Chief Medical Officer, and I started looking at, if we're going to be serving the needs that we have, we're going to need a lot of physicians. And as you know, and everybody familiar with behavioral health, psychiatrists are in short supply. So the best way that we felt like we could supply our area was for us to grow our own. And so we started working with the University of South Alabama, our strategic partners, about how can we take the Department of Psychiatry and really make it a community program with AltaPointe. USA, they subcontracted the Department of Psychiatry for us in 2006, and we've been growing the best doctors out of this area that you can ever imagine. I know hopefully Dr. Parker can talk a little bit about that. In 2015, we had another crisis that came here. In 2015, some of you remember a group called Alabama Psychiatric. They were a big location for all the private practice in the Mobile, Baldwin, Washington County areas. They had 10,000 active patients that were very, very sick types of patients. A week notice and they were closed. Our board of directors worked with us, worked with our team and said, hey, let's go in there, because if those 10,000 patients don't have a place to go, then they're going to go to the community mental health center, and right now we won't be able to handle that volume. So they approved us, and our leadership team went and we took over the department of the Alabama Psychiatric and those 10,000 patients. And so we have a program now called Baby Professional. A lot of you know what that is, to take care of the private patients that we have in this region. The big thing that happened in our region, and I think it's gotten a lot of press, is the closure of Searcy Hospital. 2012, we were working with the Department of Mental Health, and we were thinking that deinstitutionalization, I think there were those big cuts that the commissioner talked about. We started talking about the deinstitutionalization and can people be better served in the community. Well, working with the department, we were actually able to put more beds in place in the community than we actually had in Searcy Hospital. And so there's a lot of misunderstanding about state hospital closures, but when we worked hand in glove with the department to put in the appropriate services for the types of patients that we had stuck in the state hospitals, we were able to be successful. And in 2012, we actually opened up East Point Hospital in Baldwin County. It's an 82-bed psychiatric hospital. Half of it is basically for involuntary committed patients or patients who are being evaluated for commitment, and the other half is for voluntary patients, so we can try to take care of them to keep them from being committed. And so those are some initiatives that we put together because we were trying to fill those gaps. But although we had crisis services in our area before, there was nothing like a gap that we had with the crisis services that we're here today to fulfill. So we had services like a BJA grant, Bureau of Justice Assistance grant for police and mental health collaboration. It started back in 2012. We had mobile crisis teams that we had in 2012. And we had outpatient assistant teams in Baldwin County and over here in Mobile. All of those crisis services that we've put in place are really ancillary to what we're talking about that we're adding here today. All of those crisis services are being added in this huge facility here, along with the new crisis services that the governor has presented here to us. So the crisis center that we're putting here is basically made up of 3 different pieces. The first piece we call the urgent care piece. You know, how many times here in this region, these 7 counties, do we have people who are in a mental health crisis who just kind of just don't know where to go? So what do? They call their primary care physician. They're in their family's house all upset. They might go to an emergency room. It may escalate to where law enforcement has to get involved. And so wouldn't it be better if those individuals could just walk in and be able to be treated here 24 hours a day, 7 days a week by psychiatrists, nurse practitioners, psychologists, and so forth? That's what this program here does with the urgent care capacity. The other capacity that we have here is where you are right now. This is called a 23-hour temporary observation unit. It's got 15 beds. You see these reclining chairs up against the wall. Those actually sit in a circle. You start thinking, well, if I get 15 mentally ill people who are, having a crisis in one room, how is that going to work, right? This is actually a best practice model. Dr. Gibson, Deacon Griggs, we have been all over the country looking at best practice models of how do you set up a temporary observation unit for people who are in crisis. This unit is only for people who are here for 23 hours. We want to stabilize them and put them back out of this facility. The fortunate thing is that over the years, the support of the community, the department, the legislature, we've been able to grow quite a continuum of care here. So when somebody walks out of here in 23 hours, I don't want the public to think we're just putting them right back out the door. We're actually taking those people, we're reintegrating them into our other treatment specialties. We have hundreds and hundreds of residential beds in housing. We have 2 psychiatric hospitals now. We have outpatient for adults across the driveway here. We've got children's outpatient in our primary care office next door. And so when we start thinking about somebody coming in here for 23 hours, they are discharged with a plan of being reintegrated back into our service continuum. Another service that's in here is the service that we have behind us. There's 7 beds back here, and those are for somebody, if they're in temporary observation and they need to be here for longer than 23 hours, we have 7 beds back here to be able to put them in there for up to 7 days. So we have those 3 levels of care here, plus all of those ancillary crisis services that are going on throughout the entire community that are located in this building. So the coordination of crisis is really happening right here, and this is it's a really good day to be a part of this. So a couple of other people before I turn it over, I do want to recognize, of course, Jenna Walcott and Rusty, if y'all will stand. You know, when we talked about how did we get this place ready in 8 months or whatever, these are our architects. And they have worked tirelessly to do everything that we can do to get this building ready for opening. We told the commissioner that we would have it open by May 1st, and we were open by May 1st, and we appreciate it. Also, this facility has only gone through phase 1 of renovation. So we actually have phase 2 and phase 3 to continue the renovation and make this a state-of-the-art facility, and they're actually doing all of the work to help us get there. Robert Carlock is here. Where's Robert? Robert is back here. Robert is our Environment of Care Director. He worked with our architects and with everyone else you can imagine to get this facility ready to go, and we appreciate what Robert was doing. Dr. Parker, our Chief Medical Officer, also the Chair of the Department of Psychiatry, was very active in this. Megan Griggs, our Clinical Director for Adult. Megan, she's here. Dr. Cindy Gibson, who comes to us, she was a person who worked at Cersei whenever she was coming out of college. She went to Texas, worked in crisis centers that we're putting in here in Texas, came back with her expertise, and really helped us get this contract and get this place up and running clinically. Dr. Inger Reiser is the medical director of this facility. He's the assistant medical director for AltaPointe. He is the assistant medical director over our 2 hospitals, the doctors who are in those hospitals, wears many hats, but whenever you come into this facility, he is the doctor that's in charge of what we do here. And so we appreciate Dr. Inger Reiser and his commitment to it. So, without any other important things to say, I do want to say that the Delchamps family, and I don't think the Delchamps family was here, but many of you know that the Delchamps was a huge grocery store chain that was in our area, and Fred Delchamps became very, very, very interested in the community, donated tremendous amounts of money for this building to be built for the Mobile Ark, and so whenever we merged with Mobile Ark some years ago, Jeff Zogby, I think, is here. Where's Jeff? He was the CEO of Mobile Ark. When we merged, we were moving rehabilitation to the community. At some point, COVID expedited that move. And so we had this huge, beautiful building. We had some different opportunities to have other programs in here. But when we started looking at this crisis center, it became really obvious that this is where it needed to be. Fred Delchamps was a big contributor to have built this building originally. So we called his heirs and asked, we're going to change what we do in here. It's no longer going to be the intellectual disability population. We're going to put in crisis services. Some of the toughest people that we have in our community are going to be coming in here. And sometimes, as you may know, their outcomes aren't always perfect in this business. You can't really project what's going to happen sometimes, and that's just the nature of what we do. And how would your family feel about keeping your name on this building? And they said, we'll talk about it. They came back and said, we would be honored. This is what my father would have wanted to do. So this is the Delchamps building. So thank you to the Delchamps family. One other person I want to thank who helped coordinate this event and everything that we really do public relations wise is April Douglas and her team. April is back here, and April, we appreciate putting all of this together. A fantastic job. Now, without further ado, Dr. Sandra Parker, can I get you to come up and say a few words?
today, I really am going to say just a few words. And I'm going to thank some of the people that Turk has already thanked. And I want to start with the governor, which I have bragged to all my friends and family that I was going to see the governor today. And they all told me to tell you that they love your leadership, and even more importantly, they love you. I have a young female daughter, and she really aspires not to be governor. She's a dentist, but to be a leader across the state one day. And so I want to tell you I love you too. So anyway, I also want to thank Turk. If you don't know Turk, he is just the most fabulous leader. He really cares about not only the employees at AltaPointe, but the people we serve in our community. And it's his vision that has really brought AltaPointe where it is today, and his vision that's allowed us to help open this crisis center, along with Commissioner Boswell, who I've worked with many commissioners because I've been here. I'm much younger than I look, but I have been in Alabama in mental health for a very long time, and she has just been fabulous to work with, and I'm so grateful to her. And I don't want to thank everybody else that Turk thanked, although I could, but I do want to mention Dr. Ingerizer and Dr. Gibson, because they are really in the trenches here every day, as well as the rest of the staff here, our nurses, our office professionals. Everybody is coming together and doing a great job here. Another group I really want to thank is our peer counselors. This is really a peer counselor-driven program, and what I mean by that for you that may not know is we have people who have had mental illness, who some may have come through here or come through other parts of AltaPointe, who are not embarrassed to talk about their mental illness, but are proud of what they have been through and proud of where they have come and how they're doing now. And they meet with our patients that come through here and give them hope. Sometimes when a patient comes to the crisis center, they don't just want to meet with the doctor or the therapist or whatever. They want to talk to somebody that's been in their shoes. They want to talk to somebody that understands them, that can tell them this is a safe place, you're going to be okay. Follow what the doctors and therapists say. So our peer counselors here are just critical for what we do. People today have said how important this is for the 7 counties we serve, and y'all know that our purpose is to bring patients here in crisis so they don't have to go to the jail or they don't have to go to the emergency department. And I want to tell y'all why this is extra critical now. And if you have not been thinking of this, I want you to think of this and share this with all your family. Right now, our hospitals are overloaded with COVID patients. In Mobile, we may be out of bed soon. I'm not trying to sound an alarm, but I heard someone today, a physician in Mobile, say that they cannot treat the heart attacks, they cannot treat the strokes, they cannot treat all the medically ill patients because of all the COVID patients. If you have another condition, and it's not COVID, there's no room for you. And so we know how little room there would be for our psychiatric patients. We know they're kind of second fiddle in the ERs already. Not that ERs mean to be that way, but the ER is just that's the way it is. So always, but now more than ever, is a critical time for us to open up and be able to help these patients that are in crisis come here rather than going to ERs. So I hope that y'all will spread the word about COVID and also spread the word that these folks can come here and we will keep them safe and take care of them, and that we have a wonderful team to do so. I do want to tell y'all one success story, and this is pretty an amazing story, because one of the most important times of your life is when you get married, right? Do we, all of us married people, do we kind of agree with that? So we had a young woman from Michigan who had chosen to come down and get married in our beautiful part of the state on the Gulf Coast. And her husband is in the FBI, and they were in the honeymoon suite at the Battle House. And her husband knew she had bipolar disorder, but she had been stable for 5 years, and they had been together for 4, so she never had a hospitalization since he knew her, just took her medicines. Well, about 2 months before her wedding day, she decided to get off her lithium to try to lose a little weight. Well, y'all that know about mental illness know what happened, that the day of her wedding, which was, of course, your wedding day is most wonderful, it's also very stressful. She began to get psychotic, and she began to get manic, and her husband didn't even know what was going on, because while he knew the disorder, he had never experienced it. So the wedding comes off, and she's a bit odd and emotional that day, and later we know she was exhibiting some thought blocking. If you're in psychiatry, you know what I'm talking about. But anyway, that evening they go to their wonderful honeymoon suite at the Battle House, and she becomes very ill. And her husband calls her mother the next morning and says, something's going on, would you please come help us? So the mother goes over there, and the mother, who also was bipolar, knows immediately what's wrong. And, but they don't know who to turn to, how to get help or anything. Well, the girl, the bride, is not sleeping at all. So when the exhausted husband and her mother fall asleep that evening in the hotel room in the suite, the bride calls the police department and tells them that she's going to kill herself. So the police come and get her, and they bring her to the crisis center. By now, it's the very early morning hours of a Monday morning after she got married on Saturday. And thankfully, Dr. Ingerizer and Dr. Gibson were here to see her and to take care of her. Now, this young lady ended up going to our hospital because it was determined she could not be stabilized quickly enough. But she and her husband and family are so amazed at the remarkable care that she got in Mobile, Alabama, that her husband is trying to transfer to the FBI office in Mobile. So, our wonderful staff here and our wonderful providers for saving that young girl and her husband, because that's what they really did, and probably saved their marriage. So anyway, I just thank all of you who are here. You obviously care about the mentally ill, and I just appreciate you all so much for that. So thank you.
Now we're going to have a little bit of a ribbon cutting ceremony. I won't cut it, I've done this before. Let me mention a couple of our people that will be cutting the ribbon with us. Our board president, Aubrey Fuller, and also board president of AltaPointe Health, but we also have our board president of Concordia Health, Larry Jackson. They're also going to join us up here for our ribbon cutting. So y'all come on up.
Yep.
Hang on here. You ready? Let's do a picture first. Okay, everybody, let's look right here. That's great. Ready to do it? Everybody good? Okay, on the count of three. Ready? 1, 2, 3. Excellent.